Okay, so what we have here, this is our wedge, and this is for us to help strengthen the deep neck flexors. These are the muscles in the front of your neck. These muscles will get weak when we lose that overall natural arc that we should have in our neck and our head starts to come forward. And so we're going to show you exercises that you can do not only at home, but in the office when you come in. And so with the wedge, you can see how there's a cutout. That's for your neck to sit in that area. And then as well, you can see how it has a 45-degree angle and then a little 90-degree angle. The 45-degree angle is what's going to go to the back of your head so your head has something to rest on when you're lying on your back. Now, as we go into this, what I'm going to do is I'm going to hold on to the pad, because what oftentimes happens is as you do this exercise and draw your chin up, the pad slides away from you and gets out from underneath your neck. And so I'm going to you hold on to it with just a finger or two so that pad doesn't go anywhere. I'm going to have you lay down on your back when you're doing this. And when you're in this position, what we want to do is we want to draw the chin directly up. It's not bringing the chin to the chest, but it's drawing that head straight up so it creates a contraction right through the portion of the neck. And for some of you, it's going to be difficult for you to hold this for 5 seconds even. And so we just want you to work and do a couple of different reps with it. Do 5 reps when you first start. And then we're going to go ahead and have you bring your head back down. It's resting back on that 45-degree angle. And then we're going to tuck our chin and draw our chin directly back, creating a contracture. And then we're going to relax for 5 seconds. And then repeat this 5 times. Strengthen those muscles to the front portion of your neck. The next thing we're going to talk about is we're going to talk about traction exercises. And these traction exercises are essential in opening and closing the vertebra and feeding the disc structures throughout your cervical spine. So let's get started with that. Okay, this is a traction unit that you're going to be using at home as well as here in the office. And one of the biggest reasons why is we want to create an opening and a closing in between each of the discs. For instance, if you were to take a look at my hands and see that my hands are 2 vertebrae, we want, when we're doing this, an opening and a closing. That increases range of motion, movement, as well as it helps with fluid exchange with the disc structure. And that's essential. The reason why is your discs throughout your spine, they have a blood supply until sometime between the age of 13 to 20, and then that blood supply goes away. And so the way it feeds itself is through movement. And we want to keep these discs healthy for our lifetime. And so what we're going to do is we're going to grab a piece of face paper, fold it in half. They're in the pine boxes in the adjusting rooms as well as in the rehab room. And then we're going to go ahead and get positioned. And when we position ourselves for this, the piping that we see here, that's where you're going to have a couple fingers holding onto it. That needs to start off at about shoulder height. If you have it too high, you're going to be on your tippy toes and strangling yourself. And if you have it too low, you're going to be bending your knees and it's going to be more of a quad workout for you. So we'll start with it, piping at shoulder height. And then there's a chin pad. This pad goes underneath your chin. As well, this is a pad that can go onto your forehead. The only reason why it would go onto your forehead is if you're someone that suffers from TMJ or you have jaw problems. And then this pad here that's kind of C-shaped is a pad that's going to go to the back portion of your neck. So let me get in position here. Hold this down right underneath the chin. And then once I'm in this position, I'm not pulling down really hard here. The key to this exercise is relaxation and then just that opening and closing. And how we're going to do that opening and closing is it's not that we're doing anything with my neck, with the neck, mid-back, or shoulders. It's all a movement that occurs down in our legs. And it's like a squat. So I'm holding on to this piece here to help prevent it from sliding out up from underneath my chin while I'm doing it. And so let me show you how. You step up close to the wall. Feet are about shoulder width apart. I'm holding on lightly. I have a relaxation throughout all the muscles of my jaw and my shoulders. And then I just drop down and hold it for 2 seconds. Come back up. Now, as you can see here, it's just a movement of my knees. It's not a movement of my shoulders. And we're doing this a lot like if you were doing a squat, except you do a squat further. This is just to the point that you're feeling a stretch through your neck and coming back up. It's not to hang your whole body weight on your neck here. It's just a slight open and close. Okay. What we're going to do now is we're going to go into what we call our wobble chair exercise. And so this is the same type of exercise but for the lower portion of our back. and we're going to do this to warm our spines up when we start our day before we get adjusted. And it's a great way to end your day before you go to bed. So let me go ahead and show you this wobble chair exercise. Okay, now this is what we call a wobble chair. These wobble chairs are in a rehab room as well as in each of the adjusting rooms. It's a lot like a saddle, and so when you sit on this, it pivots under. You make it pivot underneath your hips, and it increases the range of motion in that lower portion of your back. It helps with the disc, and so it's just a great way to get warmed up, as I said. So let's go ahead and we'll get in a seated position here and show you how to do it. Okay, now once we're on the wobble chair, what we're going to do is we want to make sure that we're able to do the wobble chair activity that day. And I say able to because we have different stressors throughout our life. And so if we've aggravated it by doing yard work or shoveling snow, depending on what time of the year it is, we don't want to overdo this exercise. And so as we sit down on the wobble chair, we first want to just go side to side and make sure that that feels good with the lower portion of your back. Now the key with this is I want you to notice how my shoulders are staying level, and it's just all movement down in my pelvic region. It's not that I'm leaning like so to make it move. And so once we're fine going side to side, we're going to try to do the same thing front to back. And if there's no pain then, we can try to do a circle. We'll do a circle both directions. And if there's no pain there, we're going to get ourselves to a figure eight. And so when we do a figure eight, we're going to start on the front corner, one of our legs. We're going to rock back at an angle, come across the back up to the front, over again, and we're going to get that figure eight rolling. And once we're done with that, we're going to go ahead and go the other direction. And I want you to get to where you're doing 30 of these each way. And it's going to be really quick. As you can tell, since I've been sitting on here, I've done approximately 10 or 11 of them, and so we're going to get done with that exercise really fast. So when you're doing it in the office, you can just use one of the saddles. In your home care kit at home, you're going to have what we call a Dynadisc. It does the same thing as the wobble chair. And then at home as well, I'm going to have you do your head weighting. And that's the last exercise that I want to explain to you here. The head weighting is that black contraption that you see in your home care kit. And what this is it's your crown. So when you put this on, the weights are going to come to the front, and you're going to have somewhere between 1 to 3 pounds of weight. And what this is going to help do is it's going to help strengthen what we call the slow twitch muscle fibers. Those are the fibers that support our posture. If you think of fast twitch muscle fibers, those are the fibers that when you go out and you do sprints or you go to the gym and you do bicep curls and they fatigue out quickly, those are fast twitch fibers. The slow twitch fibers are the fibers that need to last us all day because they support our posture. So we're going to put this on, it's Velcro, and we're going to put it on our head. And what this does is it draws your head up into a normal positioning. If it's too much weight, it can buckle you and bring you forward. And you need to take a weight out, talk to me about that. But we want you to have the feeling that it's drawing your head back and holding your head eyes level, jaw level. And we want you to sit on your wobble chair or your Dynadisc at home while you're checking your email or playing poker or doing whatever on the computer. The thing with doing this wobble chair activity is I'm not using the backrest, and I'm not using the backrest as well of a chair when I'm using my head weight. We're doing it to where we have good posture. A great thing to do is to use your therapy ball if you're not doing your wobble chair while you're doing your head weight, because then you don't have anything to rest your back on. All right? So what we're going to do now is we're going to go ahead and show you your home care kit and talk to you a little bit about why chiropractic is important for your overall health and well-being, and we'll go there now. Now the reason why this rehab is so important in conjunction with your adjustments is because the alignment, when your alignment's off with your spine, it affects your nervous system. And so what I have here is I have the difference between a normal and abnormal x-ray of the cervical spine. And so what I want you to notice once again, and we've talked about this before, is when we look here, just a couple reference points. There's a jawline, there's a tooth, and there's a nice arcing curve throughout the neck. The curve throughout that neck, when it's there, there's less stress on the disc structures as well as the joint structures, as well there's less stress on your nervous system. This next x-ray is an abnormal x-ray. This person is in the same exact position. You can see the jawline, there's a tooth, but they've completely lost that natural arc throughout their neck. And so the thing we're concerned with in chiropractic is not only can this cause this individual a stiff neck and a headache, but this affects his nervous system. And when we talk about your nervous system is the foundation to your overall health and well-being. It consists of your brain, the spinal cord which runs down, and all these nerve roots. And those nerve roots not only go out and influence areas of where you may have pain as well as numbness and tingling into your arms, but they go out and influence the glandular structures throughout your neck. The lowest portion of your neck can go out and influence into your lungs. Chiropractic is about maximizing your health. It's about getting your spine and your nervous system as healthy as possible so that you can live the life that you are intended to live from a standpoint of wellness. We look forward to helping you. Let's show you what's in your rehab kit now. Those of you who have not made the decision at this time to be on a rehabilitative program, these are things that you can buy individually if you'd like to do that. It's all essential to make the difference to help you keep the entire spine healthy. And that's the key here. And so let me show you what we have inside. The first thing that we have is we have the traction unit. And this traction unit is what I described to you in the room. It's to work the neck, the opening and the closing of the vertebra, to help with the disc, the exchange of fluid back and forth. Inside this, it has a door hanger, and that door hanger just hangs over the door. Once again, you want to get it so that the piping is about shoulder height. And then as well, if you can take it a step further, it would be great for you just to get an eye hook and put it into a stud. I don't want you to damage the door at your house, causing any irritation to the paint. The next thing in the rehab kit is our turtle wedge. And while we're doing the turtles, once again, what we want to do is have the 45-degree angle to the back of our head. The notched out region is for our neck to set in. And this is something where we're going to be working those deep neck flexors, starting to strengthen the muscles throughout the cervical spine to help support that overall postural change that we're going to make here in the office. And then next, to help with the posture of the neck, is our head weighting unit. The head weighting unit is going to come in a package, but what I wanted you to notice here is that it's all Velcro. And so this is something that you can figure out by just Velcroing the pieces together. It's flat. If you need assistance with that, bring it into the office. We can get it dialed in for you so that it fits your head appropriately and you don't have any problems with it. It has padding. The padding goes towards the forehead region so that you don't feel any irritation from the weights being in there. And then along with that is a weight. And you're going to have anywhere between 1 to 3 of these inside your home care kit. And this is to help strengthen those muscles. Obviously, the more weight you have, the more resistance is going to be put onto the muscles. The less weight, the less resistance. But for some of you, you're not going to be able to really sustain 3 pounds. So we're going to have you start off with 1. And those just slide into the upper pockets in the front portion of the head weighting unit. And then lastly, we have our Dynadisc. The Dynadisc is what's replacing the wobble chair that I showed you to do those exercises while you're in front of the computer. So Dynadisc and head weight are going to go in front of the computer the first night you get to take this home, so when you're checking your email, you're ready to do your exercises. I'm really excited that you're here in the office and that we're going to be able to help you strengthen your spine and your nervous system. I look forward to serving you, as well as I look forward to serving your entire family and your friends. Chiropractic is about wellness. It's about abundant health. It's about throughout a lifetime. We never want to be sick, do we? We want to be healthy. And in order to achieve optimal health, we need to strive for wellness when? Always and forever. So I look forward to seeing you on your next appointment.